It is 6 minutes past 11. You are listening to the Mid Morning Talk on Sla Media with me, Maria Mukonda. Mental health refers to a person's emotional wellness and their ability to enjoy life. It is more than the absence of mental illness. It refers to a person having a sense of purpose and a sense of connectedness to others. Mental illness, however, is a psychological or emotional condition which prevents a person from functioning normally over a period of time. May is Maternal Mental Health Awareness Month, and we are going to learn some more about maternal mental health with our registered counsellor, Cayley Jorgensen, who is on the other side of the line. Good morning, Cayley, and thank you for joining me.
Awesome. Thank you so much for having me. I think it's such an important topic to talk about.
Definitely, especially because there isn't much knowledge about this. We know about post-traumatic stress disorder, and we know about postnatal depression, etc. But what do we know about maternal mental illness? So let's start there. What is maternal mental illness, and how does it tie with the definition that I just gave?
So definitely, and maternal mental health it's so important because I think a lot of the time it's overlooked. So baby blues and postpartum or postnatal depression is completely different. But basically, just kind of like in a nutshell, maternal mental health happens, or maternal mental illness, should I say, is during pregnancy or in the first couple of years after giving birth. So that's when we really see, signs of postpartum depression, antenatal depression. So it's really important to understand that this can also affect men as well as women. So I read a statistic the other day, and it's actually 1 in 10 women are affected by postpartum depression. But along those lines, 1 in 10 men are also affected, and that is a national statistic. So, not national, sorry, worldwide. So it is really amazing, and 80% of women are actually who have are pregnant or who have given birth are affected by postpartum depression. So it's a huge, huge growing number, and it is so prevalent. And I think COVID has just possibly exacerbated everything that's going on.
Definitely. With the COVID issues and the numbers continuing to rise and being the third wave, etc., I can't imagine if someone does not get or develop any sort of a mental illness. Now, what are some of the causes of a maternal mental illness? Are they the same as your regular mental illness?
So the causes are very similar, but what we do need to look at is in terms of when a woman is pregnant or when she does give birth, her hormone levels, the chemicals, all of that increase. So there's a lot of overlap in the symptoms between postpartum depression and just depression in general. So you're looking at women who are feeling really upset, crying all the time and there doesn't have to be a reason. And I think one of the most important things, just before I start talking about this, is the fact that this is not because a woman or because a new mom has done anything wrong. There is absolutely nothing wrong with having postpartum depression, and it doesn't change the way that, this lady is now. Unfortunately, depression is an illness. It does affect over 80% of women that do have children. So in that sense, any woman or any mom or anybody that is struggling with postpartum depression, please don't think that you have done anything wrong. It is not your fault. Depression is an illness, and we do need to treat it like such. So in terms of the signs and the symptoms, it's always looked at if these symptoms last for longer than 2 weeks, then that's when we more look in terms of actually seeking out a diagnosis from a psychiatrist or from a psychologist. So it's really important so baby blues are more feeling sad, feeling anxious, struggling to sleep, but that's less than 2 weeks. If that goes longer than 2 weeks, then you're looking more in terms of postpartum depression, postnatal depression, and those two words are used very interchangeably. and then antenatal depression. So in terms of the signs and symptoms, it would be just changes in eating. So either needing to eat all the time or not eating at all, trouble sleeping, not wanting to do anything, not wanting to kind of do anything that was previously enjoyed, withdrawing. And sometimes we also find that women who are experiencing postpartum depression suffer with troubling thoughts or frightening thoughts. So things like wanting to hurt the child. So again, what is really important is that a woman knows, or a mom knows, that she is not alone in this. There are professionals here to help. And if these symptoms persist, and often what we find is family members notice the symptoms and the mom doesn't, and that's also okay. But what we do need to say is, okay, let's get this new mom help. Let's get this lady some assistance, because she's not alone.
All right, we are talking about maternal mental illness, as it is a maternal mental illness in the month of May, maternal mental illness awareness rather, in the month of May. And I'm talking to registered counsellor Cayley Jorgensen, who's giving us some information and insight into maternal mental illness. If you have any comments that you would like to share or questions, please leave them in the comment section or send them to us on WhatsApp. The number is 061 766 0355. While we're trying to reestablish connection with Cayley, we mostly talk about maternal mental illness, or rather postnatal and postnatal depression, postpartum depression, etc. But I'd like to know about during the pregnancy and how common is that. If any of you have experienced some sort of mental illness during pregnancy, please let us know. How was your experience, and how did you go about getting the help, and did you receive any support from your family? Because as Cayley said, your family sees the signs, but you don't. They see the changes in you that you don't see. To you, it feels like it's normal behavior, and it's not the normal behavior that they know you to do. That's not the normal behavior they know that comes from you. So if you are noticing any changes in someone that you know, someone that you love, seek help for them. So at least they should know where they stand and whether they might have a mental illness or not. We are going to take a quick break, and when we come back, we will continue with Cayley. To stay with us.
We opened on 235
Morning. Did we lose Cayley?
Yeah. Okay, we offer something
Oh
scrumptious.
no.
The family, wraps, chicken tikka, burgers, tender grills, mocktails, milkshakes, and so much more. Corporate and events catering available. Visit our social media pages for more info or call 031 209 0119. Kiki's, the taste with kick.
Add a sprinkling of sparkles to your magical parties and special occasions with colorful party supplies and awesome helium balloons. Celebrate Ramadan and Eid in style with our stunning range of decorations, disposable tableware, gift bags, fancy boxes, elegant serviettes, and so much more. Be sparkled by our wide range of household and takeaway packaging, glassware, bakeware, and beautiful wedding accessories just for you. Sprinkles and Sparkles Party Shop. You'll want it all. Opened Monday to Sunday. Visit us at 431 Inanda Road, Parlock, Durban, South Africa. Call 031 577 0604. Follow us on Instagram at Sprink and Spark and Facebook at Sprinkles and Sparkles.
Matala Perfumes, one of the biggest perfume manufacturing houses in Africa, with a state-of-the-art manufacturing facility specializing in designing, creating, developing and producing new scents and matching designer fragrances for all our stores, as well as private labeling for individuals and companies across Africa. Visit your nearest Matala Perfumes store or visit our website at www.motalaperfumes.com for more information on creating your own brand.
Listen to something fresh. Listen to Salam Media.
Welcome back. You are listening to the Mid-Morning Talk on Salam Media. It is 17 minutes past 11 on this 25th day of May 2021. We are talking maternal mental health illness, or rather Maternal Mental Health Awareness Month, as May is famous for maternal mental health. So if you have any comments that you would like to share with us or any questions for Cayley Jorgensen, you can leave them in the comment section below or send them to us on WhatsApp. The number is 061-766-0355. Let's just see if Cayley is back on the line. Cayley?
Yes, I am back. I don't know what happened there.
All right, no problem. Thank you for staying with us now. How common is a maternal mental illness during pregnancy? Because I know we talk mostly about postnatal depression and postpartum depression, etc. But now during the process, the actual pregnancy, is there any form of depression? Does it start from there and then continue after? And how would you tell that perhaps you are having some sort of mental illness? Because with baby blues, you can tell that happens after. Now, during the process?
So that is something that we call antenatal depression. So antenatal depression is the depression that a woman would struggle with during the pregnancy, and then postpartum or postnatal is after pregnancy. So in terms of what you can experience, is the symptoms are very similar. The only difference is the timing. So with postpartum depression, again, after having the child, after birth, antenatal depression during pregnancy, and something that we often get asked is, are there antidepressants that can be taken during pregnancy? For this, I want to really just highlight and put a red flag on this question specifically, because, and why I want to put a red flag is, it is important that if you are experiencing any signs or symptoms of antenatal depression, postpartum depression, or maybe you think it's baby blues, but it's been going on for longer than 2 weeks, I really encourage all women to see somebody, see a professional, whether that's a general practitioner, so GP, a doctor, a psychiatrist, whether it's your gynecologist or your psychologist, just seeing a professional. They would then be able to assist you with regards to if medication is the route, or counseling or therapy. But it's really important that you don't firstly diagnose yourself, and secondly, that you don't put yourself on medication. Because that's, it's a risk that we don't want to take, especially with a woman's hormones changes and fluctuations as well, after birth and during pregnancy as well. So that is really, really important. And again, antenatal depression, very, very common amongst women. And if we can just look at it from a body perspective, there's so much changes, there's so many different things happening. So we do need to be aware in terms of that. Again, depression is an illness. These changes in chemical interactions in our body do affect the way we think, the way we feel. So if you are struggling, if you are a new mom, or if you are pregnant and you are feeling so sad and hopeless and you can't see the enjoyment in life, please reach out for help. If you're struggling to sleep at night, so if you are sleeping not at all, like you're not being able to sleep at night, or if you're sleeping too much and you can't get out of bed in the morning, that's something that we need to think about. So with both antenatal and postpartum depression, we need to think of it in terms of changes in behavior. Is there a change in behavior? And has that been having, experience for longer than 2 weeks? If it's longer than 2 weeks that you are not being able to, stop crying, for example, or that you are just struggling with these emotions, that's when it's time to really reach out for help. There is help that you can get. And talking to friends and family, discussing these, having open discussions about it, exercising regularly, doing self-care. It is so important, but also when you need to, reaching out to a professional for help.
And speaking about help and reaching out to professional, what sort of help does the professional provide besides antidepressants? Because, like you mentioned, the mother can't just take antidepressants. So, what other treatments are available?
So definitely there's, just speaking with a therapist or a psychologist or counselor. So processing the thoughts, processing the emotions. I like to use in my practice a solution-focused therapy. And so finding whether it's a psychologist who does solution-focused or client-centered or CBT or DBT, there's so many different types of therapies available, but really speaking to somebody that is registered with the Health Professions Council of South Africa, as this is a really important step in getting the help, and then the person that you're speaking to is registered and is also trained in what they're experiencing. So firstly, going and speaking to somebody, allowing yourself to process these thoughts, process these feelings, and learn coping skills and coping techniques in order to deal with it, as well as, whether it's just reaching out to SADC, the South African Depression Anxiety Group, speaking with a counselor there, and then getting further help. But what we really want to enforce is just being able to work through coping skills, work through coping techniques, and then again, relying on self-help, self-care, because that really, it does just meet the therapy and it continues going. So again, just in terms of getting that help, I would really say to all moms out there who are possibly struggling, please, you're not alone. Please don't forget that you are alone. We are here to help, whether it's SADC, whether it's Lifeline, whether it's Tears, whether it's anybody, just reaching out, and then also seeing a psychologist, seeing a psychiatrist, seeing a GP if you need to. It's really important, again, just to reinforce. And also, if you see somebody and they don't have a special interest in postpartum depression, they would then be able to refer you to somebody who does, because like we said, it's very common. 1 in 10 women are struggling. So it's something that we do need to create awareness for and just decrease the stigma, because it is okay to feel this way. It's not your fault, and it is an illness that we can help you with.
Definitely. And can it affect the mental illness? Can it affect the patient during, or rather, can mental illness during pregnancy affect the infant or the child?
So what I have found, and again, speaking from personal experience, is, and there's lots of different research studies on this, but we do know from some research studies that babies can pick up the feelings and emotions of the mom. But what I do want to say to women is, if you struggle with depression, or if you have a history of mental health illness, we can't see it as it's going to harm the baby, because at the end of the day, things like this happen. We know that it is really common, and I don't want moms out there to worry that their child is going to be affected or harmed in any way, and that's where it is so important that if you are struggling with depression, to see the right person, because they will then be able to help you so that it doesn't get to a stage where you're taking certain medications and then that is harming the child. So it's more just allowing yourself, we know stress can impact pregnancy, but it's working through those emotions, doing self-care, relying on a support network to help you through this, because that is far stronger, than doing it alone.
Definitely. And what impact can this have on the family as well as society?
It's a huge impact. I mean, what we do find is increased rates of postpartum or antenatal depression, especially when a mom is alone, isolated, or, there's no support system in place. That's a huge impact on the mom, on the child, but also on the community that she's in. Also, we find increased rates of postpartum depression or antenatal. I'm just going to call it postpartum, like just so that we have that general word, but so that you are, if there's a increased stress or a trauma or a sudden loss, that can definitely impact a lady or trigger postpartum depression, as well as whether there's a history of mental health or mental illness in the family. So how does mental health during pregnancy or after pregnancy impact the community? Definitely, if you've got a new mom in the community who's just had a baby, who is struggling so much, and maybe they are experiencing those frightening thoughts, you've then got the community that what we rather need to do, and again, today's Africa Day, which is fantastic. So we need to, as Africans, come together to support the mom, come together to support the child, because this is something that a new mom can't do alone. And in no world should we expect a new mom to have to do this alone. So as Africans, as a community, we need to come together and support the mom and know that it is okay. It's not her fault and she's not alone.
Definitely. And I think we should start first by talking about it and by being okay with it. Like you mentioned that it's okay to feel this way, and there's absolutely nothing wrong as long as there is some sort of help, especially from the community. If the community comes together and talk about these issues and discuss on how to help the expectant mom or moms in the community, it would really help, and it would really make a difference, instead of just oh, she's pregnant and let's just send her a plate and that's it and finish, and you don't even know what the poor woman is going through. And sometimes it's not even about the food. Perhaps she just needs somebody to help her at home, somebody to be in her presence, because she's alone and she feels like she can't do this alone, but she does not know how to express herself. She does not know how to ask for that help.
And also, if I can just add on to that, sorry, before I cut you off there, but also just in terms of like breastfeeding and challenges with breastfeeding, it can cause so much extra added stress on the mom. And again, talking with ladies, talking with people in your family, talking to professionals just to be able to help, because it's not something you need to go through alone. And I had one of my clients say to me, she feels like it's her fault because she can't breastfeed, or she was struggling to get the milk out. And that's when I had to say to her, I was like, it's not your fault. There's so many women that go through this, and whether it's joining a support group with other moms and learning different techniques, speaking with a nurse, speaking with somebody that is able to help you with different techniques that work. And maybe it's just, figuring out what's going to work for you and your baby, because you guys are two personalities. So it's then just kind of trying to say, okay, well, what's going to work for you guys as a pair? Because what works for another mom and her baby is different. So it's not that anybody's doing anything wrong.
Yeah, let's hope that we can change this with lots more education and awareness in our communities, because why not start there? Why not start from home? And we should not be afraid to make these conversations part of the dinner table and part of our social gatherings as well. Thank you so much for your time, Cayley, and for the information and insights, and have a wonderful day.
Awesome. Thank you so much. Bye.
Bye-bye. That was a registered counsellor, Cayley Jorgensen, taking us through maternal mental illness. If you'd like some more information, you can go to SADC, the South African Depression and Anxiety Group. And if you require any support, any sort of help, anything, please ask somebody for the help. I know sometimes it might be difficult to ask for the help, but do ask if you can. And if you know someone who's going through this, if you see the signs and symptoms, get the help for them, because they might not know that they are going through this and they might not know how to get help for themselves. So if you see it, do try and assist them. It is 11:31. We will be right back after the break.